Hello and welcome. Today we're discussing a condition that can be difficult to talk about, but affects many people: fecal incontinence. We'll explore what it is, what causes it, and what can be done to manage it. So, what causes fecal incontinence? There isn't usually one single culprit. It can be caused by a variety of factors, often working together. These include muscle damage, such as from childbirth or surgery involving the rectum or anus, nerve damage, potentially from diabetes, multiple sclerosis, or spinal cord injuries, chronic constipation, leading to weakened rectal muscles and overflow, severe diarrhea, making it difficult to control bowel movements, loss of rectal storage capacity, due to inflammatory bowel disease or surgery, and even cognitive impairment, affecting the ability to recognize the urge to defecate and react appropriately. Let's break down the pathophysiology. Normally, a complex interplay of muscles and nerves work together to control bowel movements. The anal sphincter muscles, internal and external, keep the anus closed. Nerves signal when the rectum is full, giving us the urge to go. The rectum stretches to accommodate stool. In fecal incontinence, one or more of these mechanisms malfunction. Weakened sphincter muscles can't maintain closure. Nerve damage disrupts signaling. Reduced rectal elasticity diminishes storage capacity. And problems in the brain or spinal cord can disrupt the normal voluntary control of bowel movements. Fecal incontinence is more common than you might think. While it can affect people of all ages, it's more prevalent in older adults, particularly women. Women are more prone due to the potential for muscle and nerve damage during childbirth. It's also more common in individuals with certain medical conditions, such as diabetes, multiple sclerosis, and irritable bowel syndrome. Accurate prevalence is difficult to determine because many people are embarrassed to seek help, leading to underreporting. Studies suggest that millions of people are affected worldwide. The signs and symptoms of fecal incontinence can vary in severity. The primary symptom is, of course, the involuntary passing of stool. This can range from occasional leakage of a small amount of stool to a complete loss of bowel control. Other symptoms may include difficulty controlling gas, urgency to have a bowel movement, soiling of underwear, skin irritation around the anus, and emotional distress, such as shame, embarrassment, and social isolation. Diagnosing fecal incontinence involves a thorough medical history and physical exam. Your doctor will ask about your bowel habits, medications, and any relevant medical conditions. A physical exam will include checking the anal area for any abnormalities. Further tests may be needed, such as an rectal manometry to measure the strength of the anal sphincter muscles, a rectal ultrasound to visualize the structures in the rectum and anus, a sigmoidoscopy or colonoscopy to examine the colon, and nerve studies to assess nerve function. Fecal incontinence can be categorized based on the underlying cause. Urge fecal incontinence involves a sudden, strong urge to defecate that cannot be controlled. Passive fecal incontinence is unintentional leakage of stool without any awareness of the need to defecate. Overflow fecal incontinence occurs when chronic constipation leads to stool impaction and liquid stool leaks around the impaction. There can also be mixed incontinence, which has the characteristics of multiple types. Treatment for fecal incontinence depends on the underlying cause and severity. Options range from lifestyle modifications to surgery. Lifestyle changes may include dietary adjustments, such as increasing fiber intake to regulate bowel movements and avoiding foods that trigger diarrhea. Bowel training can help to establish a regular bowel routine. Medications, such as anti-diarrheals or stool bulking agents, may be prescribed. Pelvic floor exercises, also known as Kegel exercises, can strengthen the anal sphincter muscles. Biofeedback therapy can help to improve awareness and control of the anal muscles. In some cases, surgery may be necessary, such as sphincteroplasty to repair damaged sphincter muscles, or a colostomy as a last resort. While not always preventable, there are steps you can take to reduce your risk of developing fecal incontinence. Maintaining a healthy weight, eating a balanced diet rich in fiber, and staying hydrated can help to prevent constipation. Regular exercise, including pelvic floor exercises, can strengthen the muscles that support bowel control. If you have diabetes or other medical conditions that can increase your risk, managing those conditions effectively is crucial. Prompt treatment of diarrhea and constipation can also help. The prognosis for fecal incontinence varies depending on the underlying cause and the effectiveness of treatment. Many people can significantly improve their symptoms with lifestyle modifications, medication, or therapy. Surgery can be successful in some cases. Research is ongoing to develop new and improved treatments. Recent advances include the development of injectable bulking agents to strengthen the anal sphincter and sacral nerve stimulation to improve nerve function. Remember, you're not alone and help is available. Talk to your doctor about your concerns and explore the treatment options that are right for you. Thank you for watching.